Hey everyone, today our topic is boundaries of abdomen. So we can start from here. Boundaries of the abdomen: superior boundary, inferior boundary, anterior, posterior, roof, and floor. First of all, superior. Superior, it is bounded by xiphoid process and costal margin. We all will see in the picture. Inferior pubic bones, upper part of pubic bones, anterior musculofibrous structures, posterior is osseo-musculofacial structure. Roof is formed by the diaphragm, and floor is formed by urogenital and pelvic diaphragm. So again, superior, it is formed by xiphoid process and costal margin. Inferior by pubic bone. Anterior wall, it is formed by musculofibrous structure. Posterior wall, it is formed by osseo-musculofacial structure. Roof is formed by the diaphragm, and floor is formed by urogenital and pelvic diaphragm. So let's see the pictures. First of all, superior boundary. It is formed by xiphoid process and costal margin. So we can see here projection, a small projection in the upper part, and it is called xiphoid process. It is called xiphoid process. And from the xiphoid process on each side there is a margin. This is called costal margin. In the second picture we can see this projected area. This is called xiphoid process, and the marked area, it is the costal margin. So superior part, it is formed by xiphoid process and costal margin. We can see here from the pictures. Next, inferior part. Inferior part, it is formed by pubic bone. We can see here the xiphoid process and costal margin. Below the xiphoid process and costal margin, the abdomen is started, and it occupies a large area, and it is bounded inferiorly by these bones. We can see here this part of the bones, and we can see this part of the bones, it is formed by pubis. So inferior part, it is formed by pubic bone. We can see picture from here, and it is formed by pubic bone, and also we can see here. Now third, the anterior wall. The anterior wall of abdomen, it is formed by musculofibrous structures. We can see the two pictures, and we also can see the structure. First of all, outside all of the structure is skin. After that, superficial fascia. These are the fibrous structure. Then we can see three muscles: external oblique, internal oblique, and transversus abdominis muscles. External oblique, we can see here also. This is external oblique, and then internal oblique, and below transversus abdominis. And also muscles, rectus abdominis, and lower part of the rectus abdominis, there is another muscle called pyramidalis. And below the three muscles, there are two other structures: the extraperitoneal fascia, and after this, parietal peritoneum. So anterior abdominal wall, it is formed by 8 layers, and it is musculofibrous. Some of parts is formed by the muscle, and some part formed by fibrous tissue. The next one, posterior wall. Posterior wall is formed by osseo-musculofacial component. We can see here osseous part, that means bones, then musculo means muscle part, and facial part or fibrous part. We can see here it is the lumbar vertebra. These are the lumbar vertebra: lumbar 1, 2, 3, lumbar 5, 4, and lumbar 5. We can see the muscle component each side of the vertebra. These are psoas major and quadratus lumborum, and some other muscle. And behind this also skin and superficial deep fascia also present. So it is posterior wall is formed by the osseous part, muscular part, and facial part. We see this in this picture. So next one, the roof of the abdominal wall is formed by the diaphragm. Here we can see the abdominal wall start from the here and ended up to this, the large area of the abdomen, and we can see the roof there is structure is called the diaphragm. Next one, floor. Floor of the abdomen is formed by two important structures: urogenital diaphragm and pelvic diaphragm. We can see in the picture, these are the lower foot. This bounded part is urogenital and pelvic diaphragm. We can see here the small area. It is the urogenital diaphragm. Through this urinary tract and genital tract passes, and rest all of the structure is pelvic diaphragm. So it's all about the boundary of the abdomen. We can see in quick recap: the superior part, it is formed by xiphoid process and costal margin. Inferior, it is formed by the pubic bone. Anterior wall formed by musculofacial compartment, and it is total 8 layers. Posterior part, it is formed by the osseous, muscular and facial part. Roof is formed by the diaphragm, and floor is formed by urogenital and pelvic diaphragm. So thank you.